My name is Audrey, and today I will be going over two mathematical models for HIV infection in the brain and their implications for treatment regimens. So, just a bit of background. Human immunodeficiency virus is a virus that attacks the immune system, and currently there is no cure, partially due to the presence of viral reservoirs or their anatomical sites in which the virus can lay dormant for years before actively reproducing again. And so we're concerned with the brain specifically because the brain is one of the least studied viral reservoirs of HIV. And if left untreated, the virus in the brain can lead to HIV-associated neurocognitive disorders. So our goal here is to utilize mathematical modeling in order to gain more insights about the viral replication within the brain in order to make better informed decisions in terms of treatment regimens for patients. So for our first model, we're concerned with the pharmacodynamics of antiretroviral therapy, or ART for short. So ART is the medication taken for HIV, and it commonly consists of anywhere from 2 to 5 drugs. And some drugs are better at controlling the virus in the brain than others, and this is due to their ability to cross this blood-brain barrier. And so keeping this in mind, we then create our mathematical model where we're modeling the virus within the plasma or the blood and the brain coupled via that blood-brain barrier. And then we incorporate the pharmacodynamics, or what happens to that viral amount when you are taking medication. And so with that in mind, we then can look at the pharmacodynamics of the drug, and then of course, validate our model against some experimental data. And so taking this model a step further, we then want to see, are some combinations of drugs more effective at controlling HIV in both the blood and the brain than others? And so what we do is, from a list of 25 FDA-approved drugs, we take all possible combinations of drugs. If you're taking one drug as medication, 2 drugs, or 3, and that leaves us with over 2,500 possible combinations. And from there, we have 3 possible outcomes when we simulate our model, where the first one is that a combination of drugs is ineffective in controlling HIV. It's partially effective, where it controls it for a period of time and then ultimately rebounds before the end of our simulation, or the combination of drugs is effective in controlling HIV. And from this, we then run a cluster analysis, and we see that each cluster essentially represents one of the 3 outcomes. And so if we want to think about the real-world application of this project, we can create something like this Tableau dashboard, where essentially if physicians wanted more information about a specific combination of drugs, maybe due to a patient having drug resistance or cost of drug being too high, or even just the accessibility to the drug, they could input any combination of drugs they'd like here, and the dashboard will return important information about that combination, as well as other drug combinations with similar outputs and efficacies. So then moving on to our second model, we are now concerned with the spatiotemporal distribution of HIV within brain regions. And so in standard clinical practice, cerebrospinal fluid, or CSF, is used to indicate the amount of virus within the brain, but we're now concerned with whether we should look at the viral amount within regions of the brain themselves. And so in collaboration with the IR lab at UC Davis, they ran an experiment on some monkeys, and they obtained various measurements of plasma viral load, CSF, as well as the viral amount within specific regions of the brain. And with that data, we then did a few different correlation analyses where we ultimately determined that we should be looking not only at plasma and CSF, because those are important, but the viral amount within regions themselves. And then we determined what regions specifically were important to look at. And so from these analyses, we then create our mathematical model where we're looking at the virus across those essential regions that we determined and giving them transmission rates. And then we run viral dynamics based on our model, and we look at those viral loads over time in those 3 different regions. We do a calibration of our model, predicted data versus our experimental data. And then, of course, we do a sensitivity analysis on our parameters in order to determine their influence on our model. So overall, from the 2 models, we can see how complex the viral dynamics can be when considering the virus in the brain. But using mathematical modeling, we are able to contribute to more knowledge, which in turn can help create better informed treatment regimens for patients. If you'd like to know more details about the model specifically and the analyses and the results that we did, I'd love to discuss at my poster at ACSESS. Thank you.